So it's been about a month since I've posted a video. I'm sorry. Life has been crazy. That's all I can say. I would explain it all, but nobody wants to hear about all my craziness. I just wanted to hop on here real quick and make a video about the next step was explaining my pathology report after my double mastectomy. What were the findings? What does it mean? Also, shout out to my awesome sister-in-law who made me this beautiful Air Force breast cancer t-shirt. Thank you, Carmen. I love it. So just real quick, real simple, I had a multifocal invasive ductal carcinoma associated with extensive ductal carcinoma in situ. So basically, it was just the cancer was present in more than one location. And the cancer invasive, meaning it had spread beyond the healthy breast tissue there, growing outside of. And ductal, just meaning that it was in my milk ducts. Let's see. And then, like I said, with extensive ductal carcinoma in situ, so it, there were other parts of within the duct cancer, but they were non-invasive. Let's see, the tumor was in the lower outer quadrant, about the 6 o'clock position. Sorry. So if you think of a clock, I think I'm backwards here, but anyways, for me, it would be, where's 6? Right here? 1, 2, 3, 4, 5. Oh, 6. 6 o'clock position. Tumor focus was measuring about 11 millimeters. So that was the out of the noted tumor sizes, the longest confluent tumor size was 11 millimeters. My overall grade, it was low grade, 1 out of 3, total score 5 out of 9. So this just means that the cancer is slower growing and less likely to spread. I don't know what it talks about. Sorry, I did not have time to review this. I'm just going to skip through it a little bit. So the cancer was on the left side. They took out, I think, a total of 15 lymph nodes. One was obviously cancerous at the time, had cancer cells at the time of surgery, and another one came back with some isolated tumor cells. And so they call this micrometastasis and isolated tumor cells. So they're too small to be seen upon exam, and they were microscopic. The longest confluent focus of metastatic carcinoma in my lymph node was measuring 0.4 millimeters, was the size of that. And then, so 2 positive nodes on the left side. And then they went ahead and did a sentinel lymph node biopsy, I believe, of the right lymph nodes as well. They took 5 and they were all clear. My type of breast cancer was ERPR positive, so estrogen and progesterone positive, just meaning that the cancer cells depend on those hormones to grow. So I've been on a medication called tamoxifen that is blocking that receptor, those hormones, to stop the growth. And then also, when I have my my breast reconstruction surgery, my GYN's going to come in as well and go ahead and take my right ovary and fallopian tube to eliminate the extra hormones as well. And then I believe, so I'll still have to take an aromatase inhibitor, I think. And because your adrenal glands and your thyroid also produce estrogen as well. I think I am not prepared for this. So then I was HER2 negative. So this is just another tumor marker that they look at. And it's a protein that helps control normal cell growth. And it was negative, so that's good. Then my Ki-67 proliferating index was 5%. This is another tumor marker. I think it's a protein found inside a cell. The rate of growth, how they divide and form a new cell. So this just tells the percentage at the rate that the cancer cell will grow, and how quickly then they're dividing to create new cancer cells. And it was 5%, so that's low. I have noted a negative growth, slower and less likely to come back with it being negative, the HER2 negative. What else? Oh, here, so they went ahead and took my left nipple, as I've said before, because it looks like it was 2.5 centimeters from the nipple. So, standard best practice, remove the nipple. Here are some results. I believe this is the Mammoprint results. After this came back, and it took a while, I would say like 3 weeks to get those results back. So that was very nervous, and just the waiting game, trying to decide what would happen with this. The Mammoprint is going to help determine how the breast cancer, I think, will respond to chemotherapy. So after we got these results, that's when, you know, I got slapped in the face. When we initially spoke with my medical oncologist, we were just thinking like 4 rounds of AC, and then this came back at high risk. Patient's Mammoprint index, MPI, 0.079. Predicted prognosis for Mammoprint high risk, 94.6% of high-risk Mammoprint patients who were treated with chemotherapy in addition to hormone therapy, tamoxifen, and a aromatase inhibitor, aromatase inhibitor, are living without distant recurrence of breast cancer at 5 years. So that being said, that I was at high risk, it was then 12 rounds of AC and, or I'm sorry, 4 rounds of AC, the Red Devil, and 12 rounds of Taxol. So I was like, okay. We were feeling not too bad about it, and then that was not fun. Yeah, so that just told us the likelihood of the cancer returning, and how I would then respond to chemo with, I think that was an oncotype test too. But I did a quick look through my records and I can't find those results. I know we did it, but I don't know what my score is. I think it's scored like 0 out of 100. But I don't know what mine was. Oncotype diagnosis test is score 0 out of 100 based on 21 specific genes in the breast tumor. Predicts response to chemo and cancer of returning. But like I said, sorry, I can't find those results. I don't know what it was. And then the last one I did find here was the genetic testing. So there was no clinical significant mutation identified. So this is like, was it hereditary? And my results were negative. No, there was no gene present. So I didn't, this wasn't passed down from family. It wasn't hereditary. And I have 2 daughters myself, currently ages 5 and 8. And, you know, fingers crossed, shouldn't be too worried about them, but I am. And I will be, yeah, especially as they're so young and, you know, research, and they're finding new things and developing new studies and genes and mutations and such, that by the time they get around to, you know, 20s, 30s, and, you know, gonna start kind of being concerned, I'm just gonna keep on them. So, okay, well, sorry, that was kind of quick and not well put together. But message me if you have any other questions. There may have been something I didn't pick up on, but I wanted to kind of just review pathology report after surgery and tell you a little bit more details about the type of breast cancer I had. Okay, I will see you later. Gotta run. Thanks. Bye.